All right, everyone, welcome back to In the Vet's Office. I am your host, Dr. Josie, and we have a very exciting episode today because we are joined with an incredibly accomplished guest, Dr. Marta Agrodnia, a highly respected veterinary surgeon with a deep passion for advancing animal care. Whether she's in the OR, mentoring young vets, or advocating for the well-being of her patients, Dr. Agrodnia brings skill, compassion, and innovation to everything she does. Welcome to In the Vet's Office.
Thank you so much for having me.
We have had a couple specialists on. I've had an oncologist, a nutritionist, an internist, but you're our first surgeon.
Fabulous.
I know. So we're excited to have you. A lot of my job, as a veterinarian is managing things medically, but there's also, a large portion that requires surgery and some of which I'm able to do as a general practitioner. And then also a fairly big chunk that we ship off to you as a board certified surgeon. Do you mind explaining a little bit what the difference between me as a general practitioner and the difference as you as a surgeon, what that is?
Sure. So in human medicine, it's very similar. We all go through 4 years of medical school, and at the end of that, we're all doctors. But on the human side, they have to go on and do some type of residency training, be it family practice, orthopedic surgery, dermatology, cardiology, something. On the veterinary side, around 5% of us after veterinary school go on to do advanced training with internships or residencies. So after 4 years of veterinary school, I did additional 4 years of anesthesia and surgical training to become a board certified surgeon.
And I always tell listeners, it's interesting because there isn't a ton of regulation around it. Like we can just, as general practitioners, say, I'll do whatever I feel comfortable with. And then when I feel like it's above my pay grade, I ship it to you. So it's kind of interesting in the way that works. I think.
Well, there needs to be flexibility, right? There needs to be flexibility in veterinary medicine to give people options.
Absolutely. Yes. Well, before we dive in and get to know you a little bit more, I always start this episode with a case of the week. And we talk about some sort of case that the listeners will find interesting and kind of giving them a peek behind the scenes of what we do in the trenches. And I figured who better to do the case than you?
Oh, sure. Well, thank you. I've been practicing for 28 years, and there is always that interesting case of the week for sure. And in our specialty practice, we do tend to see the hard cases. Recently, I had a fun case. It was a 110-pound middle-aged black lab dog that came. The dog started having difficulty eating and then finally stopped eating. And anybody who has Labrador retrievers know that is a huge red flag that something is not right. Yeah. And when the referral veterinarian took chest radiographs, the dog had a very, very large mass inside its chest. And the owners were initially told it was inoperable, but the problem is that the dog could not eat because his esophagus was completely squished by this mass. So he came to us for a full workup, and we diagnosed this dog with a type of cancer called a thymoma. And my experience with although challenging, most of them can be removed surgically. So we went in and did the surgery and removed a 12-pound thymoma from the middle of this dog's chest. And so this 110-pound dog became a 98-pound dog, and he was able to eat the day after surgery. They pursued additional treatment with chemotherapy and radiation therapy because these owners were all in, and he was still in complete remission 10 months later because I just got the feedback from this guy. So that was pretty special to take a case that nothing else was going to be able to help him and give him back his quality of life.
That's amazing. I can't imagine having a 12-pound tumor.
Can you imagine? Yeah, and he kept eating. He kept going until that esophagus was just squeezed shut and he couldn't get a single drop in.
That's so funny. You do say there are some dogs out there when they stop eating, it's bad. It's really bad.
Yeah. I myself have a black lab. I know.
Yeah, then you definitely know. They're like our garbage disposals of veterinary medicine.
Exactly. We call them our vacuum cleaner.
Yeah,
or
exactly.
What's my husband call them? Like pre-rinse or pre-wash when the dishwasher's open. He's right there.
Okay, he's like, I will help you.
Exactly.
So, okay, I feel like that's somewhat of a more extraordinary case. What are the main cases that you're seeing on a daily basis as a surgeon?
Sure. So in our practice, we do about 50% orthopedics, 50% soft tissue. And on the orthopedic side, the cruciate ligament disease is absolutely the most common thing that we see day in and day out. It's very rare for our hospital not to be doing between 1 and 4 cruciate surgeries. And so that most common surgery we do is called a TPLO or Tibial Plateau Leveling Osteotomy.
And that, for the listeners, is for, we say cruciate, and it's similar to an ACL tear in humans. We call it the cranial cruciate ligament, but it's essentially the same as the ACL in humans, which I would have to assume that the majority of listeners, if they've had dogs or multiple dogs, are familiar with this because it is super duper common.
Yeah, it's very common. As you said, the ligament function is the same between humans and dogs. It prevents the tibia from moving forward in relationship to the femur. But the difference in humans, right, is that when we injure our ACL, our cruciate ligament, it's always traumatic. And we know if we go in arthroscopically the same day we injure it, we get very set images that show us the whole knee was healthy and just that ligament was torn because we did something downhill skiing or soccer, or you name the sport, and it can happen. But in dogs, it's a degenerative process to that cruciate ligament. And if you go even the same day owners see the lameness, the arthroscopic images are completely different. And that ligament's been degenerating over a period of weeks, months, maybe even years before it finally starts to shred and tear and the dog becomes lame from it.
It's interesting because I see a lot of clients where we suspect a cruciate tear, whether it's partial or full, and clients really struggle with it because one day the dog looks fine. Yeah. And by fine, I mean like not super duper lame. And then the next day it can be really ouchy and limping. And so it kind of like waxes and wanes. And I think people have a hard time wrapping their minds around the fact that it's probably not going to get better without surgery.
Yeah, it is a degenerative process. And what I explain to owners, because sometimes owners think, oh, I shouldn't let my dog exercise because that's why they hurt their knee. I'm like, no, having strong thigh muscles is protective of the cruciate ligament, just like in people. In fact, in dogs, the only breed that doesn't get cruciate ligament disease is the greyhound because their thigh muscles are just huge compared to their body weight. So we want them active. We want them fit. It still happens in somewhere between 10 and 15% of dogs. And the reason is because they're canine. It's a species related problem. So in humans, if you're standing straight up, the top of your tibia bone is like a tabletop to the ground. It has a downward slope between 3 and 7 degrees. And the wolf has been radiographed. And interestingly, their downward slope is between 9 and 10 degrees. But the canine species, it doesn't matter if you're a Labrador or a super mutt, because I have a couple of those too, it's about 25.5 degrees. So it's about 5 times steeper than a human. So the femur is naturally falling off the back of the tibia. And it's that cruciate ligament that holds it up there. And that's why it's so susceptible to that degenerative wear and tear, breakdown, so that the fibers degenerate and then the tearing starts. And eventually it will completely tear. So in those partial cases, the evidence is becoming stronger and stronger that we should go to surgery sooner because you maintain the meniscal health, because canines, little doggies, have meniscal cartilage just like people do. And it maintains the overall cartilage health in the knee.
So the sooner the better.
The sooner the better. I do recommend operating on partial tears, and I don't say that lightly because I do a lot of training of surgeons, and I have one of my personal children is actually in human medical school, and he wants to become a human surgeon. Why humans? I don't know. I have no idea, but that's what he wants to do. But the point being is that surgery can always make a patient worse. So you have to be very thoughtful about that and always look at the risks versus the benefits. So with these partial tears, it took me a long time, and I've been practicing almost 30 years, to really feel confident that we were doing our patients a service by recommending surgery sooner rather than later. And at this point in time in my career, I am 100% behind taking partial tears to TPLO surgery. And the evidence supports that. In fact, just at the Veterinary Orthopedic Society conference this year, they did some really nice work showing that the longer an animal is lame, it actually does affect the prognosis.
Yeah, I mean, that definitely makes sense. And having had a dog that's had 2 TPLOs, one on either side. And I will say to listeners, and I'm sure you will concur, that if your pet tears one ACL or CCL on one side, they are very likely to tear the other on the other side. So I just kind of prep owners for that. What's the percentage?
It's true. It depends upon their age. So when they are 7 years or younger, it's more likely than not that other side is going to go. And why one side precedes the other, we don't know. It's just how it is. But it's true when they're younger than 7 years. But it's also good to know when they're 8 years or older, it's actually like flipped. so that it's somewhere around 70-75% likelihood if they're under 7, and it's about only 25% or so if they're 8 or older. So if it is an older animal, you can kind of take a little bit of a side, depends on how you view that glass of water, right? But it is, if your dog is 8 years or older, the chances are you'll only have to do one side.
That is interesting. Yeah, I guess it depends on how you look at the glass of water, half full or half empty.
Yeah, but
it's
it's important to know that is an age difference that we appreciate now that we didn't always appreciate.
And I do have a lot of owners say, I feel like we've really gone down this rabbit hole of TPLOs, but this is important because I know it's a lot of what
so
you
common,
do,
right?
And it is so common. I have a lot of owners say to me, oh, I'm so worried about the post-op experience, 12 weeks of post-op recovery, and experiencing it myself. Of course, 12 weeks is a long time, but they do remarkably well. I find that the overwhelming majority of my patients that do have TPLOs go on to have a great prognosis.
Yeah, and it's helpful. I can speak to it as well from the client experience side, having 2 dogs that had 4 knees done. So I've done over 2,000 TPLOs as a surgeon, and I've lived through the recovery 4 times myself personally. Yeah. And it's true, about 95% of owners feel their dogs get back to 95% or better. But there's reasons why we don't have 100%. And that's also where we talk about arthritis and how we treat arthritis.
And I think, a big portion of that too is, setting expectations that your pet has injury in its joint space, and that does predispose it to arthritis. Are there, I guess we should probably jump into arthritis in general.
That's not a good segue.
I am sure that you probably see a lot of that. How, I guess for the listeners, what are some signs that they should be looking for at home that their dog may have arthritis? And if they're seeing that, what do you recommend that they do?
Sure. Well, if their dog has a lameness, I do recommend going to your veterinarian, sooner rather than later. And that doesn't mean the first day. We can all take a bad step and maybe the next day we're fine. But I do tell owners to trust their gut. They know their dogs far better than we do. They're very attuned to their dogs. If you're seeing that lameness, see your veterinarian. The first most important step is always conservative management. Is your dog in a good body weight? Are they reasonably fit? Are they exercising on a regular basis? And once you have that conservative management, then you can start looking at medical management. And medical management could be anything from the non-steroidal anti-inflammatory drugs, which are the scientifically proven category to help with arthritis. There's other supplemental categories that the science is a little bit softer on, but still good to know about. Things like the glucosamine chondroitins, the antioxidants. You've got the pain control category like gabapentin, amantadine, tramadol. Those might be appropriate in more advanced cases. And then if there's really a joint or a couple joints that are the problem joints, you can start considering joint injections.
There's one joint injection that I have learned about fairly recently, and there's actually a veterinarian. I spoke to a surgeon in Cincinnati that's using it pretty frequently. Have you heard of Synovetin?
I have. In fact, I've been using Synovetin for, I think, 5 years now.
Okay, so you've been using it for a while. Do you mind?
I have.
I think this is a really interesting option out there for clients, and I don't know that it's as well known as, putting them on Rimadyl or putting them on gabapentin. Sure. So do you mind describing to them just a little bit about what exactly it is and how it works?
Sure. So Synovetin is a medical radiotherapeutic. So this radioisotope, it's technically known as tin-117M, it is put directly into the joint. So what's great about it is that it works at the source, and its mechanism of action is that it's taken up by macrophages and synoviocytes, and it then destroys those cells. So instead of the NSAID category of medications that stop the inflammatory cascade kind of midway through, like they're enzyme inhibitors, the Synovetin OA destroys the cells that create those inflammatory mediators. And so it's really hitting inflammation at the source. So it just does a great job at stopping that inflammatory cascade. And so it does take some time, but again, because the mechanism of action is local, You don't have to worry about any side effects with the liver or the kidneys or the GI system, because about 5% of dogs will have gastrointestinal side effects to the NSAID category. You don't have to worry about forgetting. Like I'm a doggy owner. I've got 3 dogs, and even trying to remember my own dog's medication with my busy life with kids and working is really hard. So I don't have to worry about me forgetting the medications. I don't have to worry about checking blood work. I don't have to worry about any systemic side effects. They're just not there. So once the medication is delivered, then it can take anywhere from 1 to 8 weeks to start working, because it takes time to kill off those macrophages and synoviocytes, and then all those cytokines to degrade. And it's also nice because this is a disease modifying device. So it can actually change the fluid there that helps keep the cartilage healthy. So I'm really excited to see what Synovetin is doing now and what we're going to learn more about it in the future.
What would be a case, like, are we talking a dog that comes in with elbow arthritis or knee arthritis? What does that look like?
Sure.
Like when you're like, yes,
Yeah.
you would do great with this medication?
Yeah.
Or
It's
device, I should say.
Yeah, exactly. It is FDA approved as a device for canine elbows, but because of regulations are state by state, I'm allowed to place it in any synovial joint in cats or dogs. So that's fantastic, because although elbows are the most common, I've placed it in a lot of knees, and I've placed it in just about any joint that I can get that needle into, and have seen really good effects from it.
Have you done it in, I'll say wrist to keep it simple, but the carpus?
Yes.
Okay. I have quite a few patients with wrist arthritis, so that's interesting to hear. And when you're doing it in knees, are these for patients that have had cruciate disease and then have had TPLOs, and afterwards you're giving the injection?
For myself, yes. Like those are the cases I'm seeing and I'm doing when it comes to stifles or knees. And I have been absolutely thrilled with some cases. I have one case that had bilateral TTAs, which is a similar type of surgery to the TPLO, similar but different. And this surgery was done elsewhere. It's done in New York, and the owner moved to Maine. And the dog remained mediocre. She came to me a year or so after the surgeries had been done. I started working with her, making sure, like, did your dog suffer meniscal injury after the surgery? We worked through some other types of joint injections. And then back in 2020, when I started using this, we put Seamus on the list and said, all right, let's try the Synovetin for him. And she contacted me 2 months after the device that Synovetin was placed in her dog's knees, and she's like, he's running up the mountain again. She's like, he hasn't been running in front of me for over 3 years. Now he's running in front of me. Like, she was just absolutely ecstatic. So I think about some of these cases and the recalcitrant synovitis or inflammation that stays in that joint after cruciate surgery that oral medications can't always resolve. And I find Synovetin resolves it. So I've seen really good success following some of those TPLO cases that just don't get to that 95 or 100%.
I think that's really such a great option for the listeners as owners to know that, yes, there are going to be cases where your pet far and wide really needs to have a procedure done to get them the best result possible. But then even post-op, if they don't reach 100%, we do have these joint injections, or in some cases, you may elect not to do surgery at all and just do the joint injection. So if your pet does have really bad elbow arthritis, I'm sure there's some cases where you would want to do surgery beforehand, but you could just inject the joint and they could have it sounds like a great recovery.
I've been using Synovetin for 5 years, and I've only gotten happier and happier with it. My own personal dog, like full disclosure, after he had his bilateral TPLOs, and he was a really big boy, he was running during the summer. He had his like a TPLO in December, a TPLO in February. So he's out running in the summer with his brothers outside, and he's lame in the front. I was like, you've got to be kidding me, right? Like, I'm the classic owner. Like, no, I just got through this TPLO recovery. Like, what's going on? And it was his elbows. So I was like, nope, no more surgery for you. We went right to Synovetin. And I was fortunate. He was sound for a full 18 months before I had to repeat the injection. But it was so worth not having to go back and do another surgery for him.
Yeah, or give him daily medications every single day, which I know that Synovetin is not inexpensive. I think it's, a couple $1,000. But if you think about medicating a very large dog for an entire 18 months, you're probably looking at
longer. Yeah, absolutely. And the blood work you should be checking. And my own dog, again, he's a big boy. He's a rescue, and he gets diarrhea if you look at him cross-eyed. So for him, NSAIDs are just not a good option. No, it's like I need to save my marriage, and I cannot have this dog having diarrhea in the house.
Yeah, I feel
Yeah.
that to my core. I get that. What, aside from all of the orthopedic stuff, what are some of the soft tissue procedures that you're doing as a surgeon?
Sure. Well, I personally love a lot of oncologic surgery. I love working with cancers and providing owner options. So it might be mast cell tumors that grow. It might be soft tissue sarcomas. Another really amazing surgery I had just a couple of years ago, they stayed with me, was a very, very large Great Dane. It was like 170-pound Great Dane that had the owners just noticed it was getting bloated. And so it got worked up by our internal medicine team. And they said, there's a large tumor in this dog. I don't know what it is, but we need to do something about it because there's all this fluid. The reason why the dog was looking bloated was because of free fluid in the dog's belly. So I ended up taking a football size. You got to really picture a football size, like a 25 centimeter size adrenal tumor from this dog's right side. And in addition to that, the reason why the dog lost 4 liters of fluid in its belly was because it also had a large clot inside its vena cava. So I then removed what was about the size of an orange clot out of its vena cava. And that dog was actually cured from its tumor. So it is, I love doing oncologic surgery. I love providing owners options and helping dogs, especially, like I said, when really nothing else is going to do it.
You are a brave soul. Do you ever get nervous during procedures, or are you cool as a cucumber?
I am better as I've gotten older at managing those emotions because every patient life means so much to us. And I was trained again. I was trained back in the 90s, and you're supposed to like never tell someone what you do if it was your animal. And I feel like I just don't agree with that philosophy because what owners really want to know is that you care, and would you do this if it were your own animal? And when they come into my sphere, I feel very maternal about them, and so I do have to work on that separation when I'm in the OR room to be more of a problem solver, but that animal feels like it's my animal, so it's hard for me to completely separate that.
I completely understand that. I think owners, I can't tell you how many times a week I have an owner say, what would you do if it was your pet? And we do have to be careful with that, but I
100%
do love their pets similar to how I would love my own. I don't take that lightly. And so I understand what you're saying completely.
Exactly. Because also I'm on dogs number like 6, 7, and 8 right now. I've had, 8 different dogs over the course of my lifetime, and they're not all the same. And so the choices I might make for one might not be the same. And I also acknowledge that sometimes I'm sure I know what I'm going to do given a certain set of circumstances. And then I'm there and I make a different choice, and that's okay. So I tell my all the time, I want you to feel supported no matter what you choose to do. And again, when they ask that question, what they really want to know is, do you feel that there's a right way or wrong way? And sometimes there's not. Sometimes they say there are different options. That's not a right or wrong. And it's absolutely okay to choose not to do something. Part of our job as veterinarians is to give them information so that they make the decision that's best for them, their animal, their family, their set of circumstances.
Yeah, I completely agree. I think a lot of our role is to give them the information, like you said, and then whatever's best for them, help be their support system and their expert that kind of helps guide them along the way. So, have you ever done surgery on any exotic or zoo animals, or primarily just dogs and cats?
Yeah, I primarily just do dog and cats for sure. I have had the opportunity to do some exotics over the years, some ferrets or bunnies. One of my favorite cases was a capuchin monkey because this little guy had a cancer that was really bothering him. And this was a service monkey. So his owner was a quadriplegic. Wow. So that's a whole nother level of responsibility. Right. So I did work with people familiar in the zoo setting to help us with the anesthesia because they're more like humans than anything else. But that was actually pretty amazing to just be able to interact with that little guy.
Well, I'm sorry, what kind of procedure did you do on him?
So he had a cancer that was growing on his arm. And so I had to do a soft tissue surgery to remove it, and then a little bit of reconstruction to make sure that the skin got back where it needed to be, because it's very different skin than cats and dogs.
Is it? And what is it, more thin?
It was more thin, and because the blood supply is like a human, right? So in humans, our blood supply comes up directly from the tissues underneath to our skin. But in dogs, they have much thicker skin and their blood supply comes up through a single major vein and artery. So these vessels supply a whole segment of skin. So the blood supply system is honest, it's just completely different between the two. So I had to do some research to make sure that
I did not know that.
Oh yeah, it's completely different. Yeah, it can explain a lot. I feel like I'm going to go down a rabbit hole here if I get too far, because then I
It's
start getting into the
really,
nitty gritty of things.
really interesting. And I'm assuming was intubating the monkey similar? I mean, I guess just like intubating or any other mammal.
So the monkey, I did wonder if I should intubate like you see on the human TV dramas where they're behind the head and they do that type of intubation. But because I'm a veterinarian and I'm so used to intubating looking at the face, that's how I intubated this little guy.
How interesting. And of all the procedures that you do, is there one that you find to be the most challenging, or you see it on your schedule and you're like, oh, I wish I didn't have to do this?
I think with surgery, I don't think there's one that I wish I didn't have to do. I will say there's a couple that, because they can throw you curveballs, are more stressful than other cases, like the adrenalectomies. They always have the potential to throw you a curveball. There's no such thing as a straightforward adrenalectomy. Some of those shunts, so if dog or kitty cats have vessels in the abdomen that are bypassing the liver, so what we call a shunt vessel, those are also challenging because the surgery itself can go absolutely beautifully, but yet there can still be postoperative complications that can even be life-threatening.
When I asked you this about, oh gosh, I wish I didn't see that on my schedule, I think back to all of the general practitioners I've worked with. And I think something that listeners don't know is that a lot of GPs will tell you, oh yeah, I'm fine doing a neuter, I'm fine doing a mast removal. I really don't like to do big dog spays. And I don't know that the average owner recognizes how big of a procedure it is. And I'm certainly not saying don't do it, because I highly recommend it, but it's a pretty invasive surgery that requires quite a bit of skill. So I always like to point that out to my owners.
Yeah, I do think that the veterinarian profession has done itself a disservice by minimizing the spays and neuters, because these are, especially the spays, are abdominal procedures. But even with neuters, unfortunately, I see life-threatening complications annually. And they are significant procedures. It's not just the anesthesia, it's the surgery itself. So I think I agree with you. Like, owners really do need to be made aware that this is something that's significant. We don't take it lightly. We want to do it with the utmost professionalism. And the bigger the dog, the harder it is. So I agree with you that it should be treated with the significance it deserves.
And I think we're starting to go more that way. I just, when owners get the treatment plan or the estimate for the procedure, I think they're like, wow, it's just a spay. How could it be so expensive? And I'm like, well, just a spay is a fairly complicated and requires a lot of skill procedure. So
I know. I always think about the IV catheter, the anesthesia medications, the fluids, the monitoring, the instrumentation, the time it takes, because a large dog spay is actually a major abdominal surgery. We also offer a laparoscopic spay at our clinic, which is actually a lot of fun. It's a nice option to have, but it's still a major ordeal because the anesthesia involved in that is more critical than when you're opening the abdomen. So I absolutely agree with you. And, for another thing to relate to the GP practice is whenever I have a neighbor that talks to me about, hey, this practice does a dentistry, for $800 and this other practice quoted me for $1,400. I'm like, go to the $1,400. I'm like, you're not comparing apples to apples. I promise you the $1,400 will have better monitoring. They'll have technicians that are trained to do it. They'll have them on a heating pad. They'll monitor them post dentistry. Like, that's just another one, right? That you really want to do it well, not just do it inexpensively.
Exactly. It's not worth shopping around when it comes to your pet, potentially to their life. So paying the extra $600 is worth it.
Yeah.
Okay. Anything else that you think we're missing with arthritis or cruciate disease? Anything you want to point out that you see on a daily basis that you recommend or that we should think about?
I think the big points with cruciate disease is sooner is better than later. You do want to get them before they have advanced cartilage damage and before the meniscus is damaged, if possible. I think the TPLO is a great surgery. As I said, I've done it a couple thousand times. For arthritis of all kinds, be it elbows or knees, the Synovetin is a wonderful option. It provides really long-lasting pain relief. And although it works best in the earlier stages, and it can help keep that cartilage healthier longer, which is fantastic, it also works in advanced cases. And most of the cases I'm still treating are advanced because these are the owners that are turning over every stone possible. And it's still working 75+% of the time. And I was actually looking on the Synovetin website the other day, and I was just looking at several of the testimonials and the videos up there from cases I've treated, and it just really just put a smile on my face again, seeing some of these cases that nothing else was going to work. And one case that's not on there that I wish was is this little guy who he was like a 35, 40 pound mixed breed dog that had one of those horrible stories of abuse and being thrown out of a car and ending up in a rescue. They had to remove one leg and then did surgery on the other leg. And the owner who adopted him pulled him around in a wagon, carried him outside because he was non-ambulatory. And so she came to me for assessment, and we ended up using Synovetin in the back leg because both his ankle joint and his knee joint were not in good shape. And that dog ended up walking again. And so was he a runner and playing ball? No. But was he able to walk himself outside and go to the bathroom and go for a short walk with the mom? Yes. And so that was life-changing for that dog.
That's
yeah,
very amazing.
It's pretty awesome to be able to do that, especially when surgery can't do that. In elbow dysplasia, especially more advanced elbow dysplasia, surgery is not going to help that dog, and Synovetin can.
Mm-hmm. What do you think? I know this is sort of owner or listeners may not know this, but it's a little bit of a controversial subject right now in veterinary medicine. And I feel like the listeners probably it's a little bit more mainstream. What do you think about Librela?
I do have concerns about Librela.
Just so listeners know, Librela is a monoclonal antibody, which is it's an injection that we give to dogs that helps target a specific pain pathway with arthritis. And it's fairly new to the market, and there's been some speculation that maybe there's some pretty major side effects. So we're kind of, as a profession, I would say, trying to figure out what its place is, if any. So I'll let you go from there.
Yeah, absolutely. We're still trying to figure it out for sure. And I think a lot of listeners are familiar with the monoclonal antibodies because of coronavirus, because of COVID. But this one is against the nerve growth factor. And I have listened in on some of the studies about it, showing that it works and it works well. And I even recently at the Veterinary Orthopedic Society meeting, there were 2 different presentations showing that it was better than NSAID categories, but their studies stopped at 6 months. And that bothers me. Because oftentimes our dogs need arthritis control for much longer than 6 months. And what I've seen in my own practice is kind of a wearing of the benefit. I have some colleagues who have seen some serious side effects, so they're really hesitant to use it. I like it as an option for senior animals that maybe are in their last year or 2 or 3. So I would not recommend it for dogs or cats in the single-digit years. But if we're dealing with 11, 12, 13, 14, 15-year-old dogs, 16-year-old dogs, like dogs that we do not want to take to surgery, I think it has its place. But I am worried about these side effects for sure. And I am worried about long-term benefit over short-term benefit.
Yeah, interesting. I know I have been personally using it in pets where it's really a life or death matter because they have such significant arthritis that their quality of life is not great. And it's a matter of, well, are we going to euthanize this dog or are we going to give it Librela and see if it helps? Because, and I am hesitant to use it in young dogs, though. Yeah.
I really am. Sometimes I'll have a 5-year-old dog come in already on it, and I try and just be more objective about what we know for sure versus what we have concerns about. But at this point in time, my professional opinion is that it should be held off unless we're looking at dogs in the double-digit years for which as you're saying, it's so severe that we kind of have nothing to lose and everything to gain.
All right, we are going to jump into our last segment of our episode, which is Paw and Order. And this is the segment where you, as a board certified veterinary surgeon, are going to tell us 3 things that you would not recommend doing or you would not do with your own pet.
So I actually was thinking about that part. I do think about it quite a lot because I'm a worrier with my own animals. I like check them for oral tumors on like a weekly basis, which is completely insane because they're very rare. But of course, I see them, so I'm always checking them. So one thing that's not specifically surgery, but does go to the health of animals, is I actually would not use a raw diet. A homemade diet would be fine, but I do worry about the raw diet propensity out there and the over 120 different pathogens that can be in raw diets. And there was a study that came out that showed like either listeria or salmonella in over 15% of the diets that were tested. I'm like, ooh, that's a scary number. So I would avoid raw diets.
I would like to tell listeners that we did not talk about this beforehand, but it's going to seem as though we did because I harp on this all the time.
Oh, do you?
Do not feed raw diets, especially in our kitty cats right now with the bird flu outbreak. Cats are getting bird flu from eating raw poultry. So that's just all the more reason not to. And of course, it can be dangerous to our pets, but also the people, the humans that are preparing these raw diets. If they are immunosuppressed in any way, they can also get very sick. So I am not a fan of raw food.
No. And when it comes to exercise, I do not exercise my dogs in heat and humidity. And I don't think a lot of owners appreciate how many dogs will actually run themselves literally to death. They will run themselves into heat exhaustion. They just kind of think, oh, they'll be okay. I mean, they'll go for a 10-mile bike ride when it's 80 degrees outside, and they absolutely will. So I do not exercise my dogs. I will do it in the morning or in the evening, and I let them stay couch potatoes in the middle of the day if it's hot or humid.
I completely agree. I have a German Shepherd who will not regulate his activity. He would run himself right into his grave if he could. And the big thing to remember is that these pets, they don't sweat like we do. So they regulate their body temperature through panting, and also their paw pads, which if they're on hot concrete or asphalt, it makes it very difficult to do so.
I live in I live in a very active area. There's lots of hiking trails and mountains people can hike. And I have a hard time not talking to people when I see their dog, like the tongue is out. It's like an off shade. I'm like, they're literally carrying their fur coat with them.
It's
like, oh, please
exactly.
be careful.
Exactly. And I feel like, as a owner that is not a veterinarian, you don't see dogs overheat, but we see dogs come in from overheating and heat exhaustion, and it is life-threatening, and it's a really awful thing to witness. And so I couldn't agree more with that point.
In our 24/7 clinic in the summer, we'll see a couple heat exhaustions a week. So granted, again, we are seeing the worst of the worst, but we do see it a couple times a week, and it is so preventable.
It is. All right. What's our last one?
The last one we actually touched on earlier, but it bears repeating. I would not wait in my own dog for a complete tear of the cruciate ligament before I would take them to surgery. I would absolutely take them. If they are showing me a rear limb lameness and I confirm it's cruciate, the ligament degenerative disease, I'm going to surgery at that time. I'm not waiting for a complete tear. I think that's one of those things that's out there, like don't do surgery unless it's a complete tear. It's just wrong. It was information, I think, that was out there in the 80s and 90s and into the into the 21st century when our techniques maybe weren't quite as good as addressing it. And now that the leveling technique or the TPLO, it just has such a good track record, and dogs do better when they have less arthritis and when their meniscus is intact.
I think that this is good for me to know too as a general practitioner, because we will often say, hey, why don't we just give it some time, we'll see how it goes, and 99% of the time they need to go to surgery, and something that could have been done 6 months to a year prior could potentially make their prognosis that much better. So I think that that's really important.
Yeah. And just like people, right? They're better off when their muscle mass is strong, when they're young and healthy, when they haven't been on lots of medications that aren't always great for their liver and kidneys. I agree with another saying I like to tell my owners and my son is if you can avoid surgery, you probably should, a good rule to live by. But when it comes to hind end lameness that's attributed to the knees and specifically cruciate ligament disease, what are we waiting for? Right? Like if we know it's a cruciate ligament, if the dog is lame, we take those x-rays, those radiographs, and you can see the classic changes in that knee. What are we waiting for? Because it's not, the cruciate ligament's not going to magically heal.
No.
So, that's just what I'll have that conversation with the owners early about it. It's better for the knee. It's better for the dog on every front to just go to surgery when it's a partial tear.
Yeah. And I think if I had to guess, we're not waiting. Obviously, it's not going to get better. It's only going to get worse. And I think owners are just wrapping their mind around the fact of, okay, this has to happen. But when you know it's best for your dog, it just makes all the sense in the world.
Yeah, it's a clear medical / surgical recommendation. And then owners have to decide what's best for them. And that's okay, right? I want my owners to feel supported no matter what they choose to do. But the science now is, in my opinion, it's very clear when we make a decision.
Well, thank you so much for coming on. I really appreciate your expertise and, for sharing some of your experiences. You've been doing this for a long time, and
I am the old person now in the group. I don't know how that happened, but thank you so much for having me. It's been a pleasure.
You're welcome.
What happened?
If listeners
I have 5 surgeons with me. I'm like, when did I become the old surgeon?
If listeners wanted to find you, where would they find you? Where are you located?
Yeah. So I am the owner and operator of Portland Veterinary Emergency and Specialty Care in Portland, Maine.
Amazing. Well, thank you so much for coming on. And for all of the listeners out there, as always, please rate, review, subscribe. Let us know what you thought of today's episode. You can find me on all the socials at Dr. Josie Vet, and we will see you next week.